Hi, I'm Dr. Shane Daugherty. I'm a urologist here at Meadville Medical Center. I'm a general urologist. I do have a special interest in endourology, so I focus a lot on minimally invasive procedures. I treat patients with prostate cancer, with enlarged prostates that have difficulties urinating, kidney stones, women that struggle with urinary incontinence, whether that be leakage from laugh, cough, sneeze, or just needing to run to the bathroom. I treat bladder cancer and kidney cancer. I also treat a rather large condition called neurogenic bladder for patients that have issues with emptying their bladder from neurologic conditions. I think there's usually a big surprise that women need to see a urologist. And I think that, from the standpoint of cancer, obviously women don't get prostate cancer, but they can just as well get kidney cancer and bladder cancer. Kidney stones are almost as prevalent in women as they are in men. And certainly women suffer with a tremendous amount of urinary issues as we get older and go through change of life. Also issues that I help with, prolapse, atrophic vaginitis, genitourinary syndrome of menopause, all things that fall under a urologist's purview. I think urology is such a diverse field despite being so small in its anatomical area. I had several kind of aha moments. One, just the technology that exists in urology, the lasers that we use to break up kidney stones is just inherently cool. But also the fact that my interventions really make a tangible impact. Something as straightforward as kidney cancer can be cured with my surgery alone. It doesn't necessarily require chemotherapy, same with prostate cancer. So the fact that my intervention can cause immediate tangible impact from either a quality of life standpoint or a longitudinal health standpoint really mattered a lot to me. Yeah, obviously, we deal with sensitive anatomy. Both men and women, it's a sensitive area, and there might be some degree for uncomfortability with patients wanting to approach this, mostly because they feel that it's just common as we get older. Their friends might deal with the same issues, and they equate common with being normal, and it's not. So if you're struggling, don't suffer in silence. Come see me. We have things that can be 10 minutes in the office that can have an immediate change of life for you. So don't hesitate to reach out or at least come have a chat about what our options are. I think just establishing trust within the community that I have everyone's best interest in mind. My treatment philosophy is less is more. The more that we can accomplish doing less is what's good. And I think an adage in surgery in general is, perfect is the enemy of good. So we want to make sure that we're doing really good work without trying to be perfectionists about things. We want to get the job done right and safe, but we don't want to focus on lily gilding and making things too complicated. This is a straightforward endeavor for us, so I'm glad that I'm joining the community, and I hope that you'll work closely with me. So I'm really excited that we're now offering new generational technology in the Meadville community. We're adding robotic-assisted transurethral procedure for men with an enlarged prostate that have difficulties voiding. This is an extremely common thing that people go through as men get older, and most men just deal with it. They accept that, oh, it's a fact of life, it's a fact of getting older. I start my Flomax, I start my finasteride, and some guys are happy with this, but a lot of guys are still really suffering and their quality of life is poor. Now that we have new technology in the area, we're excited to be able to bring something that can cause such a drastic change in quality of life in such a short amount of time in a very safe manner.